Among the top million websites' homepages, 98% have accessibility barriers. And WebAIM found an average of almost 60 accessibility barriers per homepage, concluding that less than 1% of homepages were actually accessible. As a result, there are about 2,500 federal lawsuits filed in the US about inaccessible websites and technologies every year. But other countries, including Canada and the EU, have stepped up more recently and learned the lessons of the ADA. And so first, to describe me, as is good practice in digital accessibility, I am a white woman with shoulder-length red hair. I had pandemic hair until about 2 weeks ago, and I cut off about 8 inches of it. I'm wearing a blue jacket, and because I never get to dress up anymore, working entirely out of my home, I'm wearing a very sparkly necklace. So it's a banner day for me. I am coming to you from my home office, which is a bedroom. So you can see part of my bed. And at some point you will see my assistant, Angie, who is a black Cocker Spaniel Border Collie mix, but she won't interrupt, and she is uninterested in the topic. So this session is entitled Not a Checklist. I'm not going to spend a lot of time talking to you about what the legal requirements are in the US or Canada, but a little bit to frame why this is not a checklist. And for information about the legal updates, the legal standards, I would refer you to Christina's session this morning, which was on ADA legal updates. But this is not a checklist exercise complying with the ADA or the Canadian laws. And it's also not a checklist to achieve actual accessibility, because technology accessibility is not about checking the boxes of WCAG 2.0. It's not about compliance with the law, and it's not a one and done proposition. Technology accessibility is about having your customers be able to use your website and technology. Technology accessibility is not one and done because it's as dynamic as your website is. Every time you change your website or update your technology, you're changing its accessibility and should be updating that accessibility. And it's not about a checklist because it's about building accessibility into your business and development processes so that accessibility is incorporated naturally, so that it's not a last-minute emergency, and so that it's not the impetus for a complaint or a lawsuit. A little bit about my background. I've been doing this a long time. I've done it in federal government. I've done it in state government. I've done it in nonprofit. I've done it in think tanks. And now I do it in private practice. So I really do come at this from a variety of different perspectives and understand the perspectives of many of the stakeholders. And for today, for questions, lest you think this is a gotcha moment, it is not. Everyone on this session has a get out of jail free card from Eve Hill, so that anything you can tell me, feel free to confess. We probably already know anyway, will not be held against you, will not result in me doing anything negative against you. So that's me on the slide, Inclusivity Strategic Consulting, yippee. And I want to start talking about the Accessibility for Ontarians with Disabilities Act, because this has really, in a legal way, incorporated much of the learning that we've done through the Americans with Disabilities Act over the last 30 years. And it has, well, they say it has 5 parts, but it really has 7. General accessibility requirements, information and communication specifically, employment, transportation, the built environment, customer service, and compliance. So the web-specific requirements of the American Accessibility for Ontarians with Disabilities Act are in Chapter 14, and they require companies to have any new websites and web content be accessible to WCAG 2.0 Level A by January 2014. So hopefully everybody's done that. And by January of this year, 2021, to have all websites and web content comply with WCAG 2.0 Level AA, with a few exceptions. And it applies to any websites that an covered entity controls, or either directly or through contract. And it's enforced not so much by litigation, but by the Ministry of Community and Social Services. So the government oversees, investigates, does audits, and so forth, and can lead to fines of up to $50,000 or $100,000 per day. But the AODA has really incorporated the compliance is not a checklist model, because companies and agencies in Ontario must implement policies around accessibility, must implement procurement requirements, must do training of employees, and must have publicly available plans about their accessibility. So the AODA policies require businesses and government entities to have external facing, publicly available policies about how they do achieve and or will achieve accessibility, and a statement of organizational commitment to meet accessibility needs in a timely manner. This is mostly about high level policies, but a best practice, in fact, a really important practice, is also to have internal policies. Your external policies mean very little if they're not implemented through internal policies that assign how to accomplish accessibility, who can provide expertise, who is responsible for accessibility, who holds the purse strings for accessibility, and how accessibility is measured and improved. So moving on to procurement, the ADA, we'll talk a little bit about, doesn't specifically require you to procure accessible technology. The AODA requires government and public sector organizations to include accessibility in their procurements, in a request for proposals, in their contracts, and requires other organizations, mostly businesses, to pay attention to accessibility when designing, procuring, or acquiring technology. So this is similar to the federal government's Section 508 requirements, which say that if they purchase, use, build, etc., technology, they have to ensure that it's accessible. A best practice for anybody, and I'll talk more about this later, is to incorporate accessible design requirements and responsibilities into vendor and service provider contracts. That protects you, the purchaser, from having responsibility for the accessibility problems that are built into something you buy. The AODA also requires training on the law for employees, for participants who develop organizational policies, and for anyone who provides goods, service, or facilities on behalf of the entity. It has to be soon, and it has to be ongoing, regularly done, and it has to be recorded. And finally, the AODA requires entities to have an accessibility plan. It recognizes that on day one, there may still be barriers. So this plan has to lay out how the organization will prevent barriers from slipping in the future, remove barriers that have already been there, and meet the legal requirements. And that plan has to be publicly available on its website and reviewed and updated every 5 years. Now, best practices for how to do this include consulting with disability organizations and people with disabilities. They are the ones who can tell you what the biggest problems are, what lots of the problems are. And it's much better to be tracking, measuring, and reporting on your progress more regularly than every 5 years. So when we work with clients, we recommend that happens at least every year, if not several times a year. Now, the ADA has a different framework. It covers state and local governments and public accommodations. There's 12 categories of public accommodations, but they're most of the kinds of businesses that we deal with regularly, doctors and lawyers and stores and so forth. And the standard for compliance with the ADA is called effective communication. Any communication that the entity makes with people without disabilities, it has to make equally effectively for people with disabilities. And the way you do that is providing auxiliary aids and services, and accessible electronic and information technology, such as websites, is an auxiliary aid. So when that is the necessary way to make something communicated effectively to people with disabilities, that's what you need to do. And part of the standard for what's effective includes that they have to be timely. So this argues strongly against, if you have a website that provides information to people without disabilities 24/7, 365, that people with disabilities should only be able to get that information during normal business hours or during certain business hours. That's not timely. Or if they have to wait days for something that everyone else can get immediately, that's not timely. It also has to protect the privacy and independence of the individual with a disability. So oftentimes companies will think, well, my website's not accessible, but I'll have customer service read them what the customer wants and take their credit card information, and we'll do it that way with a human. But that's not as private as what people without disabilities get. So that's a problem. It's also not independent the way people with disabilities get to access that service and information. So we focus on, when we're talking about what is effective communication, that it has to be accessible, timely, private, and independent, and that people with disabilities can acquire the same information, engage in the same interactions, and enjoy the same services as people without disabilities with substantially equivalent ease of use. If you look at, is this as easy for people with disabilities as it is without people without disabilities, that's really the goal. So what's the standard? The standard is effective communication. Federal government agencies, including the Justice Department, including the Section 508 law that applies directly to federal governments, including the Department of Health and Human Services, including the Department of Education, have all recognized that WCAG 2.0 level AA is a means of achieving effective communication. Now, that was never enacted into regulations, so you are not required specifically to comply with WCAG 2.0 level AA. But if you do, that'll cover you. If you can find another way to do it without complying with WCAG 2.0 level AA, you are free to do that, but you'll have to prove that it achieves effective communication. And there are a couple of defenses. Defenses are undue burden, in that this would be so significantly difficult or expensive compared to all your entity's available resources that you just can't do it, or that it would so fundamentally alter the nature of the goods or services that it would make them not do the things that they're supposed to do. All these defenses need to be documented in writing by an official who has budgetary authority. So they're the person who knows how much we can spend on this, how much it would cost, and they need to lay out why it's an undue burden or a fundamental alteration. And the entity still has to provide an alternative mechanism to get effective communication. So if we can't do it through the website for whatever reason, we still have to provide another way people with disabilities can get the same information with substantially equivalent ease of use. Now, I'm going to talk about implementation, and this is most of where I'll be focusing today. There are basically 8 buckets of implementation. The AODA lays some of these out much more explicitly than the ADA does. But as people in this field in the US implementing the ADA, this is what most of us have discovered are the things that actually work. So the AODA learned from our experiences with the ADA and made these things part of the law, because you're more likely to actually achieve compliance if you focus on these 8 buckets of approaches to accessibility. So having accessibility policies, really important. Having staffing and training. Pre-posting procedures. This is the stop digging approach to accessibility, making sure that nothing is inaccessible that you do going forward in the future. Procurement, focusing on the things you buy or use from third parties. Remediation, this is the backward looking. Okay, there are barriers. How are we going to get rid of them? How are we going to prioritize them? How fast are we going to work? Then there's the interim measures, which is the alternative access. While there are still barriers, how are you nonetheless going to get this information to people with disabilities with substantially equivalent ease of use? And then audits, which is monitoring, measuring, and making sure that progress is being made, and feedback. So talking about policies, one of the first things that folks need to do is adopt a policy and publicize it. We have a policy that everything we do will comply with WCAG 2.0 or WCAG 2.1, level A and AA. It's very important to set the standard so people know how you're judging yourself. And then to hire or assign responsible staff who has both sufficient authority and budgetary authority to get the job done, and who has sufficient expertise to understand what the problems are and how to fix them. Now, in adopting a policy and publicizing it and hiring responsible staff, some folks say to me, well, if we adopt a policy, they're going to think either that we have to comply with it right now and we're not ready, so maybe we won't adopt a policy, or it's going to highlight that we're not ready. And are we putting a target on our back to say, we haven't achieved this yet, but it is our goal to achieve this? And my answer is, every blind person who goes to your website or every person with a disability who goes to your website already knows it's not accessible. It really makes the disability community much more patient with you if they know that it's inaccessible too, and that you have a plan, ideally a plan with benchmarks and deadlines, and assigned responsible staff who has authority and who has expertise to take it on. Then we're more likely to believe you and say, okay, we're going to keep watching. And we're not just going to go after you through litigation or turning you into a federal agency. Tell us that you know and that you're working on it and how you're doing that. More transparency leads to more patience on the disability community's part. And then really important, training for developers so that they build things accessibly from the beginning. And don't forget the content creators. A lot of stuff that's on your websites and in your technology starts with someone who types up a document or a PowerPoint or whatever it is. And if those people know how to make it accessible from the beginning, then it's much easier to keep it accessible throughout the process until it's live on your website. If they don't know how, then you're spending more resources on the back end, making it accessible late. And then provide experts and resources for both developers and content creators when they run into a problem. Those can be internal or external resources. So for example, you've trained all your content creators on how to make a Word document accessible, super easy, how to convert it to a PDF and keep it accessible, again, pretty easy. And then they run into something, oh, I've got a thing, I don't know what it would be, but a thing in this document, and I don't know how to make that accessible. They need someone they can call. Make sure that they have someone they can call. So the other piece of stopping the digging of continuing to put accessibility barriers into your technology is to ensure that everything that gets posted gets reviewed before it gets posted. Create a bottleneck. I know we hate a bottleneck, but a bottleneck will save you a lot of trouble in the long term. So pre-posting reviews. I always recommend that the person who's about to post it certifies that they've checked it and it's accessible, and that you have another person, usually a person with a disability with expertise, check it too. And it doesn't go on until it passes. And then if you're going to go through an exception for undue burden or fundamental alteration, and those are pretty high standards for exceptions, you must have a process to approve those exceptions. In the AODA, it's that the piece of technology is unconvertible or that it's not within the control of the organization. You can't do it because you don't have control over it. In the ADA, it's undue burden or fundamental alteration. Someone with the appropriate authorities needs to review any request for an exception and decide whether it really meets the standards for the exception, and document whether it really meets the standards for the exception, as well as what the interim alternative measure will be for getting people information in the meantime. And then I also recommend establishing accountability mechanisms for developers and content creators who do create inaccessible material. So it's great to have a bottleneck, but if a developer keeps putting things up to the bottleneck that aren't accessible and someone else has to keep fixing them, that developer ought to have it come up in his or her performance review, because that will generate much more interest in ensuring that things are accessible before they move forward. So procurement, this has been a big problem for lots of people, colleges and universities and public schools in particular, who buy a piece of educational technology and then discover when they get a complaint or when they have a student that they can't accommodate, oh no, this isn't accessible. And there's nothing in my contract that says it has to be accessible. And now I'm on the hook to this client or this customer for that lack of accessibility. So it's very important to put accessibility language in your contracts and in your RFPs, and to have a procurement accessibility policy that is quite clear to your vendors. And then to provide in the contracts that they will give you they will certify that it's accessible. They will note any exceptions to that and why, because those are going to have to meet your undue burden or fundamental alteration standard. They will let you audit it for accessibility, and they will audit it for accessibility. And then that if there's a problem, they will fix it. Because what you don't want to have to do when you're not in the technology accessibility business is have to fix it yourself or pay somebody else to fix it. So remediation. This is the multi-year plan under the Accessibility for Ontarians with Disabilities Act, and it's the attempt to avoid liability or problems under the ADA. The first thing you need to do is identify the barriers that already exist there. That can be done by an audit, usually by an external auditor. And then there's a process to go through of prioritizing. We all know you can't do it all in one day. Well, maybe you can if there aren't very many barriers and they're simple, but very often you can't fix it all in one day. So prioritizing the barriers. What are the ones that are going to affect the most customers? That's one mechanism of prioritizing. What's the importance of the function? This is hugely important. So I've had cases where companies said, well, everything on our website is accessible except the login page. Well, that may be only one element, but it means your entire website's not accessible because I can no longer log in. So how important is the function? Why do people come to your website and what do they do there? And you probably know this through SEO. So figuring out what are my most important things and priority could be based on that. How severe is the barrier? Is it inconvenient to the user, or does it totally block the user from accessing this button or function or service? That's really important too. You want to really take care of the very severe barriers. And I always throw in, you might as well prioritize some of the easy ones so you can get some easy wins right away. If there's a barrier that appears on every page of your website, fix that one. Chances are it's part of a template. If you fix it, it'll populate all the way through the website. So I always advise people to have a barrier elimination plan. And you can do this a variety of ways. You can do it page by page. You can do it barrier type by barrier type. Like we're going to do alt text for the next 3 weeks. We're going to do nothing but add alt text. You can say we're going to do all the PDFs because that's an important piece. Or you can do it format by format. That would be PDFs versus videos versus whatever. Any of those is fine as long as you're doing them and you're doing them on a priority basis. What's most important? Assigning people who are responsible for both getting it done, oversight of getting it done, tracking and reporting on progress, and assign resources, including money and staff and time. and track and report progress, and then update your progress. Now, AODA requires that every 5 years. That is far too long to tell whether you're making progress. And while the disability community may be more patient, if you are being transparent about what you're doing and when you're doing it, 5 years is an awfully long time. I'm not sure anyone would be that patient. So here's a sample sort of worksheet for remediation of accessibility barriers. Basically just says, okay, first thing, we're going to develop and implement a policy, resources, who's going to do it, how much time are they going to do it, and completion date, what's our deadline. Those are the kinds of things you put in here, and you break it out in terms of, we're going to do all the PDFs in this timeline, and here's who's going to do it. Our external PDF converter is going to do that. Or who's going to provide our alternative access? Oh, our customer service department is going to do that. When are we going to train them? How are we going to escalate? Are we going to assign particular people to do it? Who's going to do it? How much time are they going to spend on it? And when are they going to be able to report back that it's done? And then when are they going to report back how well it's working? How many calls are they getting? How many have they fixed? How quickly were they able to respond? Did they meet their standards? And so forth. Checking the time. So in terms of going through the remediation, the other thing to be very good about is establishing and publicizing how you're going to provide alternative access during remediation. So there may be a bunch of documents on your website that nobody ever uses. They're just on there because they're cool, or some researcher might want to use them. So you nonetheless need to have an alternative. Well, they're not a high priority for making accessible because nobody's going to use them, but we are working towards that. In the meantime, here, people with disabilities, is how you ask for us to get you the document you need. In the meantime, while our website is not accessible, here is the trained customer service people who will read you the website, and they're trained to read you everything you want to know. This is a dangerous thing to try and rely on as a permanent fix. I've seen sighted people get bored reading a menu to a blind person and decide on their own, well, this person doesn't look like he likes salad. We're going to skip straight to the hamburgers. This is not okay. You need to provide ways of people knowing that there's an option and accessing the option. An email address that goes to a person, a phone call that goes to a person, and a mechanism for escalating accessibility requests and complaints. If you don't have that, then complaints are likely not getting addressed sufficiently, and the person has no one to tell to get it fixed, and that means they're more likely to tell their lawyer. And then if you're using vendors, you want to have deadlines with them to convert accessible formats, both as you're doing it on a planned basis, and for when we get a request that we need this document accessible right now. You need to know who your vendor is going to be to do that, and to have them bought into you that they're going to get it done within 24 hours or within whatever the deadline is, so that people get timely access. Then we talk about audits. I really do recommend measuring and monitoring progress through combinations of automated and manual or user audits. You can do them internally, or you can do them by a qualified vendor. But user audits are very important because, for example, sighted people, you think visually, and blind people don't necessarily think visually. So having user audits say, oh, this mechanism you've developed to deposit checks through my phone doesn't work for me because I can't find the line on the check that your computer system is looking for. Is there another way for me to do this? And you might have said, well, it didn't pop up in our WCAG automated review. That does not mean it's not a problem. So what I tend to do is recommend schedules of audits that are based on how good each business unit's controls are in place for accessibility. So I look at what are their accessibility controls in place. Does this unit have a good policy? Does it have trained people who know how to do what they're doing? Did it do really well on its last audit? And does it have a bottleneck before posting? Does it have accountability measures for people who don't create accessible content? And if it has all those things, so it has high accessibility controls in place, then it doesn't need to get reviewed that often. It can get reviewed maybe annually. If it has no or poor quality accessibility controls in place, then it's going to need to get reviewed more often, quarterly review, because you can't trust that inaccessible content is not making it onto the website. You can't trust that remediation of barriers has been happening as it should be. So it depends on how good was your past audit and how good are your controls in place. The better your past audit and the better your ongoing controls, the fewer times you probably need to have a full audit, including both vendor, automated, and user audits. And then it's really important to get feedback. This is not just the process of internally monitoring what we've fixed so far and have we met our deadlines and is it complying with WCAG. People with disabilities who are trying to use your website are actually your best experts. And many of them, when they're actually trying to use your website, will give you feedback for free. So invite it. Really say, we really want to hear from you. Welcome it and respond. Sending the feedback to an anonymous email address that you never hear back from is not a very, very satisfying mechanism of giving feedback for the person who's giving it. Publicize your efforts, your plans, and your progress. When I talk to companies who've been found to have a problem, I say, lean into it. Use yourself as a case study. Be a model for the next group, but get on it and publicize every accomplishment you make. Like I said, most of the disability community already knows. It's important that they know that you're working on it. Hire user testers. So we all complain about the unemployment rate for people with disabilities, and yet people with disabilities bring a tremendous expertise to this work. Hire them to do some of your testing. Hire them to be your beta testers before you roll something out. Make sure there are people with a variety of disabilities in your beta testing group so they can check it out, kick the tires. These are all the means of building accessibility into your business processes. Now, that's my last slide, but my basic advice to sum it all up is welcome all customers. That's what you want to do. It's not avoid a disability lawsuit. You may avoid a disability lawsuit, but people can sue over anything. Hopefully you will avoid losing a disability lawsuit if you do these things. But what you're really trying to do is welcome all customers. And companies that are in the B2B context say, well, my customers aren't people, they're other companies. Well, those customers that are other companies have ADA or AODA or EU obligations. You don't want to make your clients violate the law. They won't like it. They won't come back. And the customers of your customers have accessibilities. And be prepared. You need to have an answer to the accessibility questions that your customers are more and more going to ask. So when my firm goes to buy any kind of legal technology, we ask, is it accessible? And the answer, let me check, means no most of the time. And the answer, I'm sure it is, leads to follow-up questions. You have to be able to answer the question because your customers can't trust right now that anybody who's providing them technology services actually is meeting these standards. The other thing that I recommend is to build goodwill. And that's part of why I talk about having public policies, having transparency about what you're doing, engaging feedback, actually requesting, seeking out, doing outreach to get feedback. That builds goodwill. And showing your progress. Be transparent. We already know. We want to know that you know and that you're working on it. Build internal capacity. This is through training and through sending your folks to events like this, where you can get some real technical experience with how to do the basic things you may need to do. Choose vendors wisely and use vendors wisely. It's important to have internal capacity because you don't want to have to go back to the vendor all the time for what should be a simple question. You want to be able to do it for yourself and protect yourself through procurement. In essence, solve problems with tech staff, not lawyers. Lawyers are much more expensive and annoying. So establish it through tech staff, through content creators, through supervisors who check things before they go on, and through feedback from your customers who will tell you what your problems are. And Travis is making faces at me like I might be running out of time. But he's muted, so he can't tell me.
I was agreeing with you, but trying not to offend you on the don't rely on lawyers to solve your problems, prevent them upstream. Great ending point. And you ended to the minute on time, detail oriented, as most lawyers I know. So we've got a lot of great questions if you'd like to jump in and help us answer some of those.
Sure.
I'm gonna kind of try to pick these at random. I've been trying to respond in line to some of those things that I can answer, but let's go ahead and start out. We have Nate from Michigan State University has the question regarding procurement. What recommendations do you have for language / addendums to be added to ensure that vendors are contractually obligated to fix accessibility issues, warranty, or the like? Question.
Yeah, I have, that's part of my consulting actually. So I don't have it in front of me, but we do have, there are language you can include that will cover a variety of things, including that what the standard is of accessibility that you expect, that this is an essential term of the contract, that if any, that they will certify accessibility, that they will let you test the accessibility yourself, and that any remediation will be conducted by them on a very fast timeline. And finally, this is the one they hate the most, that they will indemnify you if it turns out that it is not accessible and you get sued.
Great, thanks. Looks like we've got a little disconnect in the video stream. So this is Eve Hill, this is not Christina, and I'm Travis, I'm not Noah. So
I wish I were Christina. I'm kidding.
Well, I didn't see her session earlier, but I think you did great. So I am going to, because of so many questions, I'm going to go based on popularity on upvote. So here's another one from Anonymous. What training resources do you recommend to implement a new accessibility training program across an organization? Really? I did a shameless plug for DQ University there, but I want to give you a chance, Eve, to answer that one.
There are a variety of them, and DQ University has some and allows you also to pick and choose what you most need. There are also things that I do, which are more along the lines of how to build it into your business process. And then there are others who will do specific techniques, how to make PDFs accessible, training content creators. It's a whole different sort of approach to it. You're not going to teach them coding, and you don't have to. So it really depends. There are a variety of vendors. I try not to make recommendations because the minute I narrow it down to the 20 that I think are good, there will be another one that I think is good. But part of it also should be some disability understanding training. So most of us who don't have any concept of what it means to be blind or deaf or have a manual dexterity impairment or a mobility impairment, we're seeing the technology accessibility piece as just a checklist, something I have to do for no reason that I understand. Like many business policies that employees face, they're like, I don't know why this makes sense, but I'll do it because it's on the checklist. We really prefer that people understand why they're doing it, because it helps you understand how to do it well. And so I always try to include a disability understanding training in that. And a shameless plug for me, I do those. But yeah, training for the right people at the right time. So you don't need to train everybody on everything. And the other thing I think is really important is having access to on-demand, just-in-time training. So I may never have been a content creator before, and now I am. But the annual training isn't for 6 more months. I can't wait 6 more months. You need to have small things that people can access when they need them, and that can be tremendously, tremendously helpful.
Great. Thanks, Eve. Let's see. We have so many good questions. A lot of them are anonymous too, so I can't follow up. Here's one that I responded to in line with a link to another session that I think might be helpful, but it's interesting. I'd love to hear your take. This is anonymous as well. What is the best practice for assigning responsibility for accessibility when your website is so large that there are a number of distributed teams working on individual sections?
Yeah, then I assign responsibility in a number of ways. And this is why it's not a one size fits all issue, but each business unit, each unit that's responsible for a different part of the website has to have all the controls in it. So they have to have the developers who know what they're doing. They have to have the person who's going to check before it's posted. They have to have their audits. And that's why I have a different audit schedules for different units, depending on how good their controls are. And then overall, there's going to be, I would put it in the overall oversight of the whole program, the whole web program, of doing the audits and following up and holding each business unit accountable. The money also can be, you can either put the resources in each business unit, but very often it's helpful to put that at an overall overall position as well, because then that person can make better determinations. Number one, they're going to have access to more money than each business unit. And some business units may need more, some may need less. So it's important to be able to allocate the resources to meet the need, and not just based on, oh, every business unit gets $1,000. And that person is more likely, a higher up person in the hierarchy of the organization together is also much more likely to be able to deal with exceptions requests, because they may be the position who has a high enough authority and budget authority to be able to say, yeah, no, you don't get that exception. I also often involve experts and people with disabilities in the exception review process. So it's not just one person. It needs to be a person with enough expertise to push back and say, no, that's not that hard.
Yeah.
But if the staff person doesn't have the expertise to say, no, that's not that hard, people with disabilities and experts in the field will have the expertise to be able to say, I don't understand why you're saying I can't caption this video. So those are very important checks, and they also help with the, not transparency, because you don't want people talking about every exception, that should be confidential, but to be able to verify that this company is doing important things and really working on it.
That's great advice, Eve. In a past life, we called those exceptions waivers, and then we started calling it the W word, right? Like it's really easy to call undue burden, but if you really have the technical expertise to understand the problem, fewer people abuse that sort of to get around it.
It's too hard for me does not make it an undue burden, or I don't know how doesn't make it a fundamental alteration.
Or I have a shiny new feature that I want to release instead of doing this, right? Yeah.
I'm in a hurry also does not make it an undue burden or fundamental alteration.
That's great advice. It's definitely good to hear from your side of the table. Let's see, we've got time for a couple more. Here's a good one from Kara, or Kara, if I'm saying that properly. What liability is held on a consultancy when working with a client on a digital product? So who holds the burden of accessibility?
I get that question a lot, and it depends entirely on, well, it depends on the contract for one thing, but it also depends entirely on the facts. So the consultants who will assist you with making your website accessible do it in a variety of ways. Sometimes they say, give it to us, we'll make it accessible, and then they give it back to you. And so on that day, they may be responsible, assuming your contract provides for that. Because on that day, they've asserted that it's accessible. 2 days later, when you've changed something about it, if that's the thing that's not accessible, well, that's on you. So it really depends on what is the thing that's not accessible and who was in fact responsible for doing it. And then what does the contract say?
Great. So unfortunately, we have so many good questions. We have time for only one more. Well, actually, there's been a lot of questions about if your materials will be available. And I think the answer is yes. You've submitted them to us. So they're either on the session site now, and if you refresh it, they may show up. We apologize for the lag there. We're just making sure that the content's completely accessible, because that would be bad if it was not. Given
if DQ allows me to, I will put it on our inclusivity.consulting website as well, and you can get it there.
Yeah, I think that's also fine. It's your content, but it should be at least by end of day available on our the specific session page for your talk. And I just want to thank everybody for your participation, and please go forth and enjoy the rest of AxCon. Thank you, Eve, for this really awesome talk.
Thank you all. Have a great day.
Cheers.